Good morning, good morning, good morning, everybody. Good morning, good morning. Good to see everybody. Good morning. Welcome to our 20th annual San Andreas Regional Center Luncheon. This opening area here is an opportunity for us to speak to the people and to really highlight some of the areas that we are working on together. I am Javier Zaldivar, and I am the Executive Director of San Andreas Regional Center. And for me, going on over 20 years of providing support, services, advocacy for the people in society that need it, and our obligation to really keep the promise of the Luncheon Act, which is the promise that everybody gets to live in their community, in their home, as they see fit, and it's our obligation to make sure that we provide the necessary programming and services. San Andreas Regional Center is one of 21 regional centers, which is funded by the Department of Developmental Services in Sacramento. San Andreas Regional Center covers the counties of Santa Clara, San Benito, Monterey, and Santa Cruz. We serve approximately 15,000 individuals in multiple settings. We serve individuals in the early start program, 0 to 3, and then we serve people throughout their lifetime. Some of the services that we provide include respite and placement, life planning, advocacy, service planning, and transitional as people transition in the various stages of life. One of the things we are really hoping is that we provide people with a quality service and a service that really they can depend on, as they are so critical to make sure that overall we have a system in place that is going to be solid and not in a state of limbo. Over the last few years, it has become more and more challenging in order to deliver a service. It is critical, and we implore the governor to take a close look at what the promise of the Luncheon Act is, what is our obligation, but more importantly, what is our promise? What did we say in that wonderful act? It's a wonderful piece of civil legislation that really guarantees that everybody has an opportunity, and there shouldn't be any ability or disability that will prevent us from honoring that. To that end, San Andreas Regional Center continues to provide wonderful services, and we do it with many friends in our corner. And we have many people that have helped us understand our plight and to help educate people both locally in the communities, at the state level, and in the legislature as we move forward. One of the people that has been a true champion and a friend of ours for many years is Senator Beall. And I am very honored to introduce to you Senator Beall, District 15, a friend, a colleague, and more importantly, a champion of the people. Senator Beall.
Thank you, Javier. Good morning, everybody. And I'm Senator Beall, and it's my pleasure to join you today to speak up for the 278,000 children and adults served by regional centers and providers across California. The developmental disability systems is in crisis, and we must act now. Waiting is no longer an option. Since 2009, $1 billion has been slashed from developmental services programs. And prior to that, the state has frozen rates to providers in order to contain cost. The governor's proposed budget does nothing to restore the $1 billion cut. The governor's budget does nothing to fulfill the obligation and carry out the Luncheon Act. People with developmental disabilities have seen the quality and effectiveness of services and supports wither. Providers are closing doors every day because they can no longer afford to keep them open. The Department of Developmental Services estimates a 30% loss of service vendors in the system of care since 2009. Meanwhile, the community system has grown by over 30,000 new consumers. Delaying actions risk the lives of the 278,000 individuals we are pledged to protect. We are asking the governor and the legislature for a modest 10% increase for our regional centers and providers in the budget. Now, I have a letter that I started in February. And this is the letter right here. I have copies for the media if they want to get a copy of it. And it argues our case that we have that unlike other departments, I'm on the Public Safety Budget Committee. We had a 4-hour hearing on the prison. They want another $1 billion for the prison, right? State prisons, including their COLAs, their regular COLAs. We're asking for the same kind of treatment. We're actually asking for pretty much equal treatment to the programs for the 278,000 developmentally disabled community as the prison gets. Isn't that something? We want the same treatment as the people that are incarcerated, and we want the same treatment that has not been given people that have developmental disabilities, that are given people that are murderers, rapists, criminals. They're given better treatment and better health care and better services than people that have developmental disabilities. And I'm not saying they shouldn't have those services, but I am saying is the people that are covered under the Latterman Act should get the same kind of treatment. Same kind of treatment, right? Should get the same kind of treatment. So we have worked hard at a grassroots level to get a letter signed, and there's a copy. We have copies here. And I'd like to announce that right now we have 55 legislators that have signed this letter. 55. We have 55. This is probably the largest single effort in the legislature this year to get support for the Department of Developmental Services. Now, let's work together to get if we get to 60, that's a majority. So let's get to 60. We got to get 5 more, right? So let's find out who hasn't signed it yet. Let's find out who hasn't signed this letter yet and make them sign it, right? We want to go after them. Okay, you ready to go after them? Yeah, let's do it. Let's get those signatures. Now, before I close, I'd like to thank Debbie Ellis, Chair of the Service Providers Committee. Debbie, thank you. And, of course, Javier for coordinating the press conference from the San Andreas Regional Center. But, I especially want to thank the hundreds of parents who have and clients from the developmental centers, the parents and clients, who have gone to Sacramento to just educate the legislators on this emergency. This is an emergency. And we like to thank the 55 legislators that signed the letter, and we're asking for that 10% increase. The cards are stacked against us, really, okay? I want to say it's not going to be easy. How many people think it's easy? How many people think it's going to be a struggle and a fight? Now, are you ready to fight? Are you ready to fight? I am ready to fight, so let's fight for what we want. Let's fight for that 10% increase. Thank you very much. Thank you. Let's go for it. Thank you.
Hello, my name is Rick Rollins. I am a parent of a 24-year-old son with autism. Russell, many of you may have seen on the cover of Newsweek magazine a few years back. I'm also, and for the last 19 years, have been the legislative advocate for ARCA, Association of Regional Center Agencies. And I'm here today at the invitation of your wonderful regional center to talk, and I'll be speaking later about the crisis in our system and the need for the 10% increase. You are so blessed here in this region to have wonderful leaders in the developmental disabilities community, and there's no stronger voice for advocacy in the entire legislature than Senator Jim Beall. So once again, please join me and recognize him for his tireless effort, for all his great work for the people, not only here in San Andreas, but throughout California. Senator Beall has many issues that he's involved with in Sacramento, but there's none that's more paramount to him, both personally and professionally, than the support for people with developmental disabilities. As a parent of a child with autism, and I about 20 years ago, was able to get the Department of Developmental Services to do a report on the increase in autism in California, which really became the match that lit the whole autism awareness movement, not only here in California, but throughout the country. And for the autism population, as with all of our populations, we are in the middle of a crisis to rebuild the structure, the infrastructure of this system and services that for current clients, and of course, we don't have the luxury like the education community does with a waxing and waning of populations. Once someone is found eligible for services in our system, they're there either until they lose the diagnosis of the condition or pass away. And our numbers continue to increase dramatically in all areas, but particularly on the autism side. And the need for the development of services for adolescents and adults and for families who have aging children is absolutely critical. So I look forward to continue to work both as a parent and a professional in this area. Again, want to thank Senator Beall for his great work. This letter is so important because it puts people on record in supporting our efforts. And we will go back to every one of the signatories of this letter and ask them in the caucuses and behind closed doors and with the governor to express their priority for this 10% increase. And again, thank you very much for having me today. And again, thank you, Senator Beall, for all your great work.
Good morning. Let's try that again. Good morning. We're going to need those loud voices because they're going to have to hear us in Sacramento. So this is the first of many things that you all are going to have to do the remainder of this legislative session to help champions like Senator Beall, who've been there for us. And it's only if we're going to be able to get behind him and his efforts and the other folks who understand the nature of this problem that we're really going to be able to bring the change that we want. So this press conference is not the end. This is the beginning of what has to happen. And I hope everybody understands that and is ready to roll up their sleeves and get to work. I am the Chief of Staff for San Jose Mayor Sam Liccardo, but I'm really here today as a parent of somebody who has severe developmental disabilities. We have 4 children, and our youngest has been a beneficiary of services from SARC for a long time. And if you look at the report that was just completed, my goodness, what a dire picture it paints. And how much do we need these needed changes that Senator Beall is pushing for? You know, you look at the caseload ratios, you look at the service rates, you look at the amount invested per waiver recipient. Some of those statistics are downright embarrassing. They'd be embarrassing for anywhere in the country, much less to be happening in California, the nation's leading state, the 7th largest economy in the world. That's something that has to change. And I think parents and those who receive these services, we all saw the same thing, right? When the economy got bad, services got cut. The economy's starting to get better, but the services really haven't come back, have they? And what we're running into now with the good economy is talent, people who are providing services and our private sector partners and nonprofit partners, they're having a harder and harder time finding people to staff what families need so desperately. So it's actually getting harder even though the economy is getting better. And it's getting harder from where it was after those cuts took place in the Great Recession. So that's what we've got to turn around. And one of the key ways we have to do that is through partnerships. It's working with folks who are providers, working with private sectors. It's local governments coming in to help regional centers like San Andreas. Above all, it's being smart about money though, right? There are federal dollars that are at stake where we have to do things to be able to receive those dollars, to make sure those dollars get to the folks who need the services. Our ratios are so bad in terms of caseloads, we're in violation of the terms that are required to get federal funding. We're living on borrowed time, folks. Washington, D.C. is hurting for money just like we are. If we can't fix that soon, who knows what's going to happen to those funding sources? And we know we have to make changes by 2019 anyway, or we're definitely not going to be getting those federal funds, so let's start now. And I guess, the final thing, if you haven't been a parent or if you haven't been one who receives these services, I say this with all possible respect, but you can't imagine the impact that a regional center has in your life. These are not optional services. These are lifelines for the people who get them. They're emotional lifelines, they're physical and material lifelines as well. And the people who provide these services are angels. And how can we as a state, as a society, not value these people appropriately with even an adequate amount of funding? And that's what we've got to change. I think it was Yogi Berra who said a long time ago, 90% of life is just showing up. Or maybe it was Woody Allen or somebody like that. I think the senator will agree, when it comes to making your voice felt in Sacramento, 100% is about whether you show up or not. It's about whether you lobby your legislator, it's about whether you write letters, it's about whether you make phone calls, and whether you make your voice heard. So it's up to all of us, the change that we want to see happen. Let's use this as a building block for making that change possible. Thank you very much.
Good morning, everyone. How's everyone doing? Good. Well, hello. My name is Debbie Ellis, and I am a grandparent of two beautiful young men, one 15 with autism, and the other one is 14 with epilepsy. I am a service provider. I'm a board member of the San Andreas Regional Center, and I am the chairperson for the Service Provider Advisory Committee representing service providers with San Andreas Regional Center. As providers, we all got together, putting aside our individual organizational needs, coming up with what our issues and concerns are as a community, because waiting no longer is an option for us. We have suffered drastic reductions since 2009. Prior to 2009, the state had frozen rates to providers in order for the state to contain cost as part of the overall budget. As providers, we are coming together as a community, speaking with one voice with the same message, and we are all supporting the Lanterman Coalition 10%. We need an increase in rates covering the federal mandates regarding overtime changes, along with minimum wage adjustments across the state, addressing the shortfalls not only for providers, but for the regional center as well. A cost of living adjustment from year to year to keep with cost fluctuations while the state looks at rate reform, overhauling the current rate structure that is in place, allowing for rate adjustments when the state mandates policy changes. Financial relief is needed now. If we do not act now, and I really mean now, many providers will no longer be able to provide the critical services that are needed on a daily basis. Our regional center will not be able to attract nor retain employees supporting our families, supporting providers, and most of all, supporting the individuals we all serve. We need to look at our future, as we will not be able to sustain our programs and the many services we all provide. At the end of the day, it's all about you, the individuals who count on our services that we provide for all of you. We are a system in crisis. Relief is needed now. So So I am a service provider for San Andreas Regional Center. We all got together and we really wanted to show everyone that this is just not an issue for San Andreas Regional Center. This is an issue for the whole state of California. This is hitting all providers everywhere. So we have some special guests. We have providers from the Golden Gate Regional Center, and we have providers from the Regional Center of the East Bay to also speak their stories on the issues that they're facing, serving all of you. So my first guest is going to be Kim Johnson Luqman. She's the CEO from Hammerbeck.
Good morning, and thank you for having me here today. My name is Kim Luqman, and I'm with Harambe Community Services. We're a specialized provider that provides services to consumers with behavioral and mental health challenges. And we operate in the counties of Alameda, Contra Costa, San Francisco, and San Mateo. Currently, we've been around for over 9 years, and we currently serve about 55 participants right now with a long waiting list. I'm here to speak to you today from the perspective of a provider. Our value as an organization is to provide robust, person-centered services and supports for our consumers. But it has become very, very challenging to do that the way that we should and that we owe our consumers. The financial pressures on us as providers is significant and severe. And I'll just share with you what it's like to be a provider under this kind of environment. For one, some of the previous speakers spoke about the fact that many providers have closed, and the increased financial pressures puts a huge amount of strain on the organizations, creating lots of financial instability, organizational instability. The challenges of hiring staff. We want to be able to provide the best services and supports we can for our consumers. My program, which is a specialized behavioral program, requires that we have a 1-to-1, a 1-to-2, and a maximum 1-to-3 staff ratio. So it is critical that we're able to provide staffing for our consumers in order to operate. It is an extreme challenge to be able to attract good, quality, committed people when wages are hovering around minimum wage. We're not getting reimbursed to even meet current minimum wage standards. We invest a huge amount of time and money in training our employees so that they can provide the best level of service. That is increasingly harder to do, especially when you invest in training and then you have staff turnover because you can't compete in the marketplace to keep people in your organization. And it's just a challenge to be responsive and to provide, again, the best service. Our value as an organization is to support our consumers to the level that they deserve. And that doesn't even speak to the fact that there are now mandates that are coming that we all have to meet that are not funded. So in addition to the challenges we have today of providing the services that we need to provide today, but in terms of being able to support our participants around employment, self-determination, community integration without additional financial support is just, I don't know how we can do that. So it is imperative that we have the starting point of the 10% increase and then go from there. Thank you very much.
Our next special guest is Kevin Rath. He's the Executive Director for Man and Home Care.
Good morning. My name is Kevin Rath, and I'm Executive Director of Manos, an employee-owned agency serving 1,200 people with disabilities in the East Bay. I'm also representing the California Respite Association at the Lanterman Coalition. Our situation at Manos provides a clear example of the problems people with disabilities face. It's important to remember that we can't separate service agencies from people with disabilities. If we don't deliver services, then people with disabilities don't get the services they need. It's that simple. On March 2nd, the Oakland minimum wage went from $9 to $12.25 an hour with 2 weeks of paid vacation. Since we provide 10,000 hours of service to over 350 clients in Oakland, that minimum wage is costing us $30,000 a month, an unsustainable situation. While negotiations are in progress with the state, we still have not received a cent to pay for these minimum wage costs. How did we get here as a community? How did we get into such a situation? We're here because the state has no clear method to increase the service provider rates. Without a clear way to increase rates, there is no money to pay for even the most basic cost increases. Many stakeholders are working with the state to come up with clear funding models and methods, but unfortunately, that's not going to help us this year. So take Manos' story and times it by the thousands of agencies serving people with disabilities in California, and you get an idea of the situation that people with disabilities are in. We need immediate relief. Which brings us to the proposal from the Lanterman Coalition. The Lanterman Coalition is the largest group of associations that our community has ever formed. Parent groups, service agencies, unions, self-advocacy groups, and regional centers, which coordinate care. All associations who represent people with disabilities and the programs and workers that serve them. We are united to speak with one voice and one request, that the state of California increase funding for all services by 10%. 10% now. 10% with no excuses. 10% across the board, because we are all hurting really, really bad. This is not a joke. 10% because we need it. We need it. Not for a vacation to Hawaii, not for a new car, and not for nice office furniture. We need 10% to survive. So Governor Brown, so state senators, so assembly members, we respectfully request a 10% increase for the most vulnerable people in our society so that they too can live the California promise of a meaningful life as equal citizens in this great state. Thank you very much.
There you have it, my friends. In the end, it is all about serving the individuals who rely on it. And people like Maya Barakat here, who is on the San Andreas Board of Directors, she helps us advocate and she helps us make sure that that spirit, that promise, and more importantly, the commitment is always going to be there, and that we are not going to be balancing what is a budget on the backs of the people that can least afford to have it balanced on. 2 seconds.
You guys are here for me.
And we are here for each other. Thank you, everybody, for coming to our press conference. We are going to head into the banquet hall so we can start sitting down and having lunch. All right, guys, we'll see you in an hour. So thank you again for coming.